Assalamu alaikum, you're watching Views and News, and I'm Faisal Rehman from our Islamabad studios. Today we'll be talking about this COVID-19 situation in Pakistan. As we all know now, there is this new variant called Delta, and now that is considered as a killer variant. And if you remember what happened in India, that was primarily because of this particular variant. Now it has diffused into Pakistan also. Talking about the situation in Sindh, in particular about Karachi, we all know about the positivity rate that was hovering around 20 to 25%. That was unbelievable. Similarly, since they have imposed a lockdown, so we hope and pray that situation is going to get better. Secondly, now the good news is that according to the head of the NCOC, Asad Umar, he has said that around 1.07 million doses were given to the people in one day. So we have exceeded that 1 million mark a day. So that is very positive, and I hope that within the next 10 days, another 10 million people will be vaccinated. The current number stands at around 3 crore, 30 million. That is still a milestone that which we have achieved. Other than that, we have also learned that this particular variant, the Delta variant, is very much transmissible. We used to follow a certain set of protocols, not to touch your hands, to your face, nose or mouth in particular. Cover yourself, wear a mask, make sure that a certain distance that is around 6 feet is maintained. But looking at this new variant, I guess the SOPs, they need to be revised as well. People have started taking it very casually. Hardly anybody is wearing masks. I mean, that is another reality, because after the vaccination, people believe that they cannot get COVID-19. But the story is that a lot of people who have had 2 vaccinations still became victim to this new variant, Delta, and most of them are on oxygen at the moment as we speak. That is perhaps the real challenge the government as well as the country is going to face. To talk about that, let me quickly introduce you to our panelists. We will be talking to Dr. Rana Jawad Asghar Saab, expert on infectious diseases. Dr. Saab is joining us from Pakistan. And we'll also be talking to Dr. Nauman Zaffar Saab, expert on infectious diseases, who is going to join us from Florida, USA. Thank you, gentlemen, for your time, sir. Thank you very much for talking to us on this very important topic. Now, let me start off from you straight away, Dr. Rana Jawad Asghar Saab. We have been hearing about this Delta variant. Is it different from the previous ones? Is it really lethal? Is it more transmissible? Do we really need to have new SOPs in place for that? How to cope up? Your take, sir.
Thank you very much for inviting. Yes, Delta virus has changed the game, as they are saying all across the world. And it has changed the game by a couple of facts. One, it is highly infectious, up to 200% more infectious than the older strain. That means whatever SOPs we were following, we have to develop those SOPs. Second, is that, compared to previous strains, the viral load is around 1,000 times more in noses and throats of the patient. So if a viral load is at such a high number, the potential of serious disease or the disease with complications goes up. That is just based on the fact that we know that it is many times more, the viral load in nose. It has not been confirmed in the field studies yet, the lethality, the increase in lethality, but there is certainly a potential that it may be a bit more lethal than the previous ones. Third, because the total number of patients is increasing by the mere fact that it is more infectious, that means we will see increased number of patients who may be requiring hospitals, who may be requiring advanced life support system. The only good thing at this moment is in few countries which has a high level of vaccination coverage. In those countries, even with the Delta, seriousness of disease in vaccinated is much less as compared to the seriousness of disease in the vaccinated group. So for the country like Pakistan, which has recently increased the pace of vaccination, which is a very good thing, and we are doing it very nicely. I must appreciate the fact, the way the pace has been picked up. But if we look at the overall picture, right now, only around a little more than 3% of population of Pakistan is fully vaccinated. That means they have got both of their injections and now they are protected, whatever to whatever extent uh, as per their vaccine, whatever vaccine they got. So, but if we look at our target population of above 18 years, that means that around 6% or between 6 to 7% population is protected. So we are still far away to that level of protection or vaccination, which will give us as a population level benefit. But so until that time happens, uh, we all need to focus on the same SOPs which we have discussed so many times on your show. But only make sure we need to make sure that we do it more religiously, much stronger than what we were doing earlier, because this virus is 200% more infectious.
I mean, that is very alarming, Dr. Saab, and very, very serious, I would say. But coming to you now, Dr. Saab, Dr. Nauman Zaffar, since Dr. Jawad talked about the virus load, and we've also learned that this stays in your mouth and in your throat, and it is 1,000 times more in terms of COVID load. So that is perhaps one of the reasons that a lot of people who have had two vaccinations, whether of Sinopharm or Sinovac or others, perhaps they are also getting this COVID-19. And I know a few people, even one of our colleague is in the hospital and again on oxygen despite having COVID before and on top having both the vaccinations, sir, and despite the fact that that person in particular is very careful but still ended up getting COVID, perhaps due to Eid and Eid Milan parties and get-togethers. Your take, sir?
I mean, thank you very much, Faisal bhai. But yes, that's the problem with this delta. I mean, you see what's happening in Florida. Means whole United States is one side and Florida is one side, because means probably May, when they took all this mask guidance off and they just went back to regular routine. And that time I literally was holding my head. I said, what are they doing? Because this is going to happen. And we have about 20,000, 25,000 cases, around 23, 25,000 documented cases. Again, we were just talking that these cases are usually is about, I would say, 5 times less what the real cases are. So you have this number of cases, and these are all delta. Here, majority of the delta hospitalizations are among non-vaccinated. So about 99%, 99.5% are unvaccinated people. But there are because the JJ, especially the Johnson and Johnson, they people have breakthrough infections. People have breakthrough infections on Pfizer also, Pfizer and Moderna, but it's less and less severity. Most of the people I know who had actually a breakthrough infection, they were mostly mild, a sore throat, coughing, fever, and chills for like day or two. That's a good sign. But in Pakistan, on the other hand, I know many people that just like you're telling me, with this Chinese vaccine, they have actually some of them got more sicker. I have my one of my aunts. She has pneumonia right now. She's fully vaccinated. My father had COVID even after the full vaccination, but he was comparatively milder. But he's still 10 days of sickness, chest pains, short breath, coughing. So there are breakthrough infections, less in messenger RNA vaccines, more in the other Chinese vaccines. So, but again, if you look up the whole overall scenario and the picture, still they are much, much, much safer as compared to the people who are unvaccinated. Because unvaccinated people, when you don't have the spike protein antibodies, you don't have anything in the body to fight it. So now you're just leaving it up to the nature whether you're going to respond. You're among those 83% who have a mild COVID, or you're going to have among those 17 or 20% who are going to have very severe disease. But again, comparing to like a regular COVID, it was even different. This is, as we're talking about it, it's like highly transmissible. And one more interesting thing we also noting here, and same thing we probably seen in Pakistan with Delta, with the original strain, if you're fully vaccinated, you get infected, you do the COVID test, it comes back negative. But with Delta, if you're infected, because the viral load is so high that you actually come back positive most of the time. And then because if the viral load is high, automatically you're going to transfer. Even if you're vaccinated, even if you don't have any symptoms, you still can transfer. That's the problem going on, and that's why it is flying all over. It's like United States actually back to, I'd say, square one. So even after what 50 first shot, we had about 58% people about had first shot, around 50% are fully vaccinated. Even then, you have about 125,000 documented cases. Again, they are, in my personal opinion, they're like 5 times less. Because I see a patient, he gets COVID, he has positive test, but then you have 17 other family members who are sick, but they're not doing the test. Same thing,
Correct.
I think it's like more maybe 10 times in Pakistan that people don't do the test.
Or
So the
that's very
numbers you see,
important.
you're saying the numbers you see, basically this is tip of iceberg. So any the COVID numbers, the cases numbers are, I mean, from the day one, they are way less what the real infection is going on in the community. So
And
I
I'm
think
sure, sir, the same stands for most of these countries. You're talking about United States of America, I would say, even in Pakistan, the actual number of cases, that's very, very high. I mean, looking at the positivity rate in Karachi, and then since a lot of people who used to travel abroad before, they're not going abroad. Instead, they are going towards the northern side. And look at the positivity rate in Skardu, in Gilgit, in Hunza, and especially in the northern areas. That has skyrocketed as well. And this is so transmissible, as you just mentioned. So God knows at what level we're going to put a check. Coming back to you, Dr. Asghar, now, it is generally believed that whether you have had Sinopharm, Sinovac, Moderna, Pfizer, Johnson & Johnson, or perhaps the Russian vaccination, still you are very much, under the threat because of this new variant that's keep on mutating, and that has become a problem. Since you talked about the SOPs they should be in place, government is doing whatever they are supposed to do, and they can in their given capacity. But having said that, sir, it is the attitude of the people. Initially, now they have said that they will close down the marriage halls, the indoor dining, and so on and so forth. The basic SOPs the government take into account. But it's the attitude of the people. Two areas: A, those who are vaccinated, they believe that they will never get COVID. And secondly, there is another group, they believe that there is no point in getting it. It's a conspiracy theory, basically. And this is something man-made, unfortunately, to minimize or perhaps put a check on the population or something of that. So let's clear that wrong perception. Please, Dr. Saab. And I want your comment on this, and then I would like Dr. Nauman also to comment on this. Please, Dr. Asghar first.
Yes. So, one thing I disagree, and I disagree with it from the very start of the pandemic. We cannot blame people. Even yesterday, on all television channels, there was a live press conference by some senior government minister, and none of the people in that press conference was wearing any masks. So my point is that if the leadership, and I include both government and opposition, or even influencer, anybody people look toward, if they are not following SOPs, we cannot expect general public to follow our directives. So it need to start from the very top, without any exception. Everyone who comes on a television channel or go to any official meeting should be wearing a mask, and if not, there should be some repercussion for that person. That's number one. Number two is that the whole issue of you missed one group of the vaccine hesitancy. These are the people who got COVID and now think they already have once COVID, and now they are protected. They don't need a vaccination. That was a big group also in Pakistan. But we need to understand the fact first that the immunity acquired through infection and immunity acquired through vaccines are a bit different. And recently, multiple papers have come up which have shown that even though the naturally acquired immunity is good, but the immunity acquired through recent vaccines is much better. So for our own sake, it's important, especially when the variants come. Then the vaccine-derived immunity has those, let's say, capabilities to fight off at least some variants. So I want to make sure that people understand that having COVID does not give you guarantee that you will be disease free in the future. So you should get vaccinated irrespective you had COVID or not. The second thing is all the misconceptions about the vaccines. And, I'm amazed that it was not the uneducated class who was hesitant. Many of highly educated people, um, and even with the professional degrees, and some in the even the healthcare business were also hesitant. And I think the reason of their hesitancy came from these social media, and people don't realize that every news which come through WhatsApp or Facebook, they are not real news, and you need to go to the context of that small clip, that what is the real reason. And but that created a lot of mistrust about vaccines. So those people now are being forced to vaccinate, and I think that's a good part of the government and different organizations which have now made it mandatory
Mandatory,
for
yes.
the employment, for the work, that you need to have a vaccination. That has actually, where I failed to convince some of my friends to get vaccinated. I think once their organizations decided, that situation has changed. So I think in public health, we always do multiple things. We do health education, we try to convince them, and then sometimes we need legislation to make sure that we can, stop people from doing something injurious to their own health. So, and I think all this is helping now the vaccination drive up. But the one danger is that once we're going to reach at certain level, then again that comes like what we call a break stop or a stop break, where then you have to double up your efforts to convince the last 50% of the population to get vaccination. And that happens with all vaccinations. So where I'm happy that our vaccination rate is increasing, I'm also concerned what is our backup plan when we gonna hit that first roadblock, when we will be, where people will say, no, we don't want to get vaccinated no matter what. And that happens in US also, that after like 60 or 70% in some states, then it's very difficult to increase that percentage beyond a certain level. So we have to come up with a backup plan now at this moment.
And I'm sure the government should be working, NCOC should be looking into this issue, because as we have understood so far during the last almost 2 years now, that this is going to keep mutating. This is going to get from bad to worse, and this is the reality. I think the vaccination would keep on changing as well according to the level of threat that is posed by the particular variant. Now over to you, Dr. Nauman. First of all, talk about the conspiracy theories, because that is where the problem starts. A lot of educated people also do not get vaccinated because of various facts. God knows what sort of a concern this particular vaccination has got with 5G. People who are in Europe are also looking at it, that why are we forced to take it? Even in Pakistan, that now the SIMs are being blocked, so people are rushing to get vaccinated. Earlier, when they were told that there is a threat to your life, nobody bothered. Your take, sir.
Again, we discussed this, that is human nature, whether you are a Pakistani, whether you're a British citizen and American, that has came like really in light, that the human nature is same. So you have same some around 50% of the people who say the corona is still, even after almost, well, like 1.5 year, they say corona is fraud. So I think first part is it's man-made or not man-made. We don't know. If you see the conversation between, there is a recent fight between Dr. Fauci and there is like a Rand Paul senator, and what the story was that NIH, the American Institute, actually had a fund. So somehow or the other, this fund was actually awarded to the Wuhan lab, and so he was accusing that you actually. I want to explain this so people, because a lot of people actually send the videos to me on WhatsApp, so that's why I'm explaining. So there was some fund being awarded as an award to Wuhan lab. there was a question that the Wuhan lab actually was working on this COVID, actually coronavirus. They're combining different coronaviruses and actually making novel coronaviruses. And they were doing it just to prevent another pandemic. God knows whether it's leaked from there, whether it was made in the lab, it was leaked there. They were accusing Dr. Fauci and NIH about it. That I don't know. Only these guys obviously will know whether it's leaked, man-made or not man-made. But the point, what we are talking is, whatever it is, man-made, unman-made, non-man-made, unintentional or intentionally leaked, now you and me, we all are facing this. So the only way to actually fight this to get vaccination, to get a herd immunity. So, as far as that's why, I mean, nobody is forcing the vaccine because they have some kind of a chip or there's some kind of like a control. They are forcing because now, unintentional or intentionally, it is leaked. And now the whole all world, the whole governments, the economies, they are in jeopardy. So that the only way you come back to a normal life is you get immunity. And the way to get immunity, obviously, either in infection, and you don't want to have 80% of population in the world to have been infected, because then the 5% or 3% will die. So that's why the real answer to this, whatever it is, wherever it is came from, we have to get vaccinated. There is, because that's the same fear that today we have Delta, and maybe 6 months later we have Alpha, Beta, Gamma, like other variants, and maybe these vaccines, they are working somewhat now against Delta. The new variants, vaccines may not work, and there is already Pfizer has already made a booster, and that has including this Delta. It's not approved by FDA, but I'm pretty sure, probably my guess is around September or October, they have to bring this variant, because I check my antibodies level every month. So my antibody level from this, I got vaccine in December. My antibodies were positive in February. Again, that's important point. So people understand that they got a shot. Oh, I'm vaccinated. No, after the second shot, it took 4 weeks to actually have that spike protein antibody. 4 weeks
Okay.
after the second shot. So they say about 2 to 4
Now,
weeks
now
after
Dr.
the
Saab,
second.
since you were talking about this booster shot that Pfizer has created, or perhaps we would learn that Moderna would come up with a similar plan at some stage, perhaps Johnson and Johnson. But my point is, sir, for example, I've had Sinopharm, right? A lot of
Yeah.
people had Sinovac also. Is it okay for a person who has had one brand of that vaccination and can have the booster of a Pfizer? Can you mix them? Because at the end of the day, it's all about creating those antibodies. Does it work that way, or it can have a clash? Because you're the
No,
right
I
person to
think you're
put this question
100%
to.
right. What so far the data, there are some couple of researches going on that you give, for example, AstraZeneca, and then you give a shot of Pfizer, and then the antibodies. Yes, you need to look up the end result. The end result is we need spike protein antibody wherever, whether it's Sinovac, whether it's Pfizer, whether it's Johnson and Johnson, means they. I mean, right now, means I think there's a definite research going on this, and I think that should be okay eventually. That you got Chinese vaccine, no problem. You got whatever, and now if you're getting a Moderna, you're getting Pfizer, because the end goal is same. End goal is you get a spike protein, whatever way it is. So I think it will be allowed eventually by all our FDA and then Pakistanis, all our health departments. But I think that's the way it is. And again, means the same thing. One thing the people understand: oh, I'm vaccinated. Like next day, they are. I have one of our family friend. They died in April. Same thing. They got vaccine, and the next day they were just not taking care at all. That's a very important thing to understand for people, that they think, oh, I'm vaccinated. First of all, you're not fully vaccinated until you have antibodies. And it will take, I repeat, it will take 2 to 4 weeks after the second shot, number one. Number two, measles vaccine, chickenpox vaccine was different. You had measles, the virus doesn't change. That's why you will get the vaccine, 2 shots, you're done forever. You
Okay.
have chickenpox, 2 shots, you're done forever, because the virus has not changed. But the coronavirus, you look up from type 1 to type 7, you get sore throat, coughing every, if you can get exposed to, like as somebody who's sick. This is corona, like corona type 1, type 2, type 3. So coronavirus itself, because it changes, that's why you cannot have one vaccine or 2 shots in your life and you're protected forever. So that was already clear even before the vaccine, that vaccination does not mean you're not going to get COVID, because the corona will change. You will get the infection. Mostly, hopefully, it will be mild. But again, this thought. I mean, I was in Pakistan. I'm eating dinner and I'm like using sanitizer, and like all my friends are laughing. Oh, you're not vaccinated? I said vaccination does not mean that you just leave all kind of
Exactly.
like you
Precautions.
have to still take care of yourself and the people and family around you, because it will protect you from hopefully dying and hopefully getting hospitalized or to be on ventilator. But it does not mean, especially only with COVID, I'm not talking measles, we're not talking chickenpox, that it will actually protect you from the severe disease but not protect you from getting the disease itself.
All right. Now, Dr. Asghar, lockdowns or no lockdowns, smart lockdowns or complete shutdowns, curfew like situation, or closing down of schools and colleges. I mean, now we have learned that there's a certain percentage of people who can sit in a train. 50% people, according to the capacity of the bus, could be there. Like instead of two, you just need to have one, and so on and so forth. But still, since you were talking about that this is too transmissible, don't you think the government really should act wisely, and the sort of decision they have taken regarding opening up of the schools, and especially when it comes to kids? We've also learned that kids are also very vulnerable. Initially, we never heard when this wave started, or not the wave, but this corona phenomena came into being. We got to know that mostly older people, 60 and above, were getting infected, and perhaps the death rate was higher among that particular group. But now we have learned that even youngsters, kids, are also getting this particular variant. And yesterday, good news again for the Pakistanis, that all those who are 16 years old and above will get vaccinated also. Your take on that particular part, sir?
Yes, and I think it's a very important issue which you have mentioned. Um, I was just reading today World Health Organization report on COVID-19 and what didn't went well, especially in our region. And one point they said was that the decisions were not based on the available data. Like your data is telling you something else, and the governments are making decisions contrary to their own data. And that's a problem here also because, in Pakistan, in recent weeks, in last 4 weeks, our case numbers have quadrupled from less than 1,000. Now we are around 5,000, and our case positivity have also increased 4 times, from less than 2% to more than 8% in just 4 weeks. That's a huge increase in a short time. Then most of our major cities have a high positivity rate at this moment, and they are in double digits. And the third important thing is that even with those numbers, high numbers and high positivity, we also look at the trend, how these things are going. All the trends are going up. In that scenario, number one, I fail to understand why government, allowed the school to reopen. That doesn't make any sense. Government's NCOC's own position on this is that if a city has more than 5% case positivity rate, we should not open schools in that district.
Exactly.
My surprise is that when our big cities have a positivity rate of 10, 15, 20%, with all the underreporting, which is we understand, but still, how the schools are still open and government didn't intervene on that reopening. So that's the major issue. Second, with the Delta, the children's were less prone to severe disease, that's for sure. But with the Delta, the number of sick people have increased tremendously. So if previously you had 100 people and there were only one kid who had a serious complication, and now you have 1,000 cases, there will be 10 kids who will be sicker. So when you change the denominator, even if
Exactly.
the lethality of disease stays the same, the more children will be sick and more will be prone to serious conditions. But now, as we discussed earlier, because the high viral load of Delta, there are already some people have come up with those studies or ongoing studies that they feel that children are getting more sicker with this delta. Not confirmed yet, but there are people have strong hypotheses on that. In that scenario, I think we should, and one thing more, which was neglected when we talk about the children, that most of them had mild disease, the issue of long COVID, which is also now being identified in children. And long COVID is that even if you have the milder COVID, weeks or months later, you will still have some persistent symptoms of the disease, and it could be neurological, it could be, all your body systems. So
Because
it's
Dr.
not
Saab,
that
now
you have.
I'll just take a short break here. But after the break, I'll be also joined in by PJ Mir Saab, senior journalist, senior anchor person. And I would like you to also answer a couple of very important points that I have in my mind. For example, how do people end up having COVID? And after that, I mean, they say that their energy level isn't back. They were not smokers, they were very healthy people, but they have not fully recovered. Few of them, they haven't been able to, retrieve their own taste buds, that particular problem that they're facing. Smell, that is another issue. Physical exertion, I mean, the moment they'll do anything, they'll feel so excited. I mean, they can't carry on with any physical kind of job, sir. So I'll be asking you those questions after the break. We'll just take a short break here. After the break, we'll return and we'll be having PJ Mir Saab along with Dr. Rana Jawad Asghar and Dr. Nauman Zaffar. Stay with us. Welcome back after the break. Now, Dr. Rana Jawad Asghar, Dr. Nauman Zaffar, they are already with us, but we've also been joined in by PJ Mir Saab, senior journalist, senior anchor person. Mir Saab, Assalamu Alaikum, and thank you so much for your time. Mir Saab, can you hear? Hello? Let me start off from you then, Rana Jawad Asghar Saab. Jawad Saab, one important factor which I earlier asked you about before we were taking the break. Let's throw light on that particular aspect, sir.
Sorry, could you repeat the question, please?
Yeah, I'll do that. Sir, there were like, obviously we were talking about the SOPs in place by NCOC, despite the fact that now we have also learned that smart lockdowns, schools, and so on and so forth. Now, since we were talking about the positivity rate that is hovering around 8%, that is a very, very dangerous, bar, I would say. Now, the government, the sort of intervention the government needs to take in, because, when you tell them to close down the shops, they do not listen. I'm talking about the shopkeepers. You talk about following the SOPs, so nobody does, nobody wears a mask. Don't you think now strict measures should be in place? And at least there should be some sort of fines imposed on all those individuals, because I'm telling you from my personal experience that initially people used to make lines when they were entering the drugstores, for that matter, to get any medicine. There used to be proper squares, marks, where you will keep a social distance maintained. But now, forget about the social distancing. Nobody's wearing a mask, and it's a different ballgame altogether, sir. People are not realizing. Do you believe a proper campaign should be launched? What sort of an SOP should be in place now?
Yes, and as we discussed, the government ministers, government functionaries, and or political leaders have to follow those SOPs. And I agree with you, if anyone does not follow those, and simple measure of wearing mask in public places, those people should be fined irrespective of the fact who they may be. So that's how we will start doing this. As we discuss also, that Delta variant is twice more infectious, more easily transferable from one person to another That means we need to, make our SOPs more strict, more firm, not let them go the way as you have described in shops and offices. So the government has to step up, making sure that those markets should be closed if they are not following SOPs. And I think the punishment should not be the individual one. It should be, our repercussion should be a
It should be a
market-wise,
collective one,
because
yes?
all markets have organizations which represent them, and they are the best people to ensure those SOPs could be followed or should be followed. Third thing, I think one thing, because in the start, because this was not part of the SOPs, but very quickly picked up by scientists, but very recently CDC and World Health Organization has accepted the fact that that this virus is mostly airborne, and with airborne we
Airborne,
need
yes.
to bring in those precautions which minimize its effects. And that's simple: open up your windows, open up your doors, use fans. My personal advice would be to also turn off the air condition if you do not have those specialized filters or fit in your air condition at public places. I know it's very hot and humid season in Pakistan, but safety of you and your customers, I think, are more important than little bit comfort or discomfort in these 1 or 2 months. So these are the simple steps which government should include in those SOPs, which is do as much as your business in the outside. If you are inside, make sure your windows and doors are open, fans are working, so there is no, even if
There should be
someone with
proper
the
ventilation,
active,
basically, that's what you're talking about.
exactly,
Instead of
exactly.
sitting in a closed room where the air condition is on and you have closed windows, so obviously more chances of getting the virus. Now, sir, we've also been joined in by PJ Mir Saab, and let's see what's the story like in England, because we have also learned, Mir Saab, that the SOPs are not being followed. Nobody is forced to wear a mask now because according to the law, restaurants are open, shops are open, even bars are open, and the number on daily basis is hovering around 60,000 cases. So this is the story of UK. Your own experience, Mir Saab, how are people reacting to it? Are they really taking it very casually now? What is it like out there?
Well, they've already observed the Freedom Day, which meant that all restrictions were over, everything was back to normal, and things getting back to normal. But you see, this is, we've got the fourth wave coming up there, and people are still thinking, what to do, or at least the government is thinking. Now here, what we need to do is, whether it's England or Pakistan or anywhere in the world, it's up to the people of that, of that region to observe what the medical authorities or the government instructions are. Sadly, unfortunately, it's not happening. There are still, small cafes, which are still, getting along with the business by not adhering to, what the government instructions are. You've got to wear a mask. I mean, if you go back in time, and so you'd know that the Chinese, they started wearing masks long time ago because of the pollution. And today, we've got this, as far as Pakistan is concerned, not a national, a situation, but it's an international calamity. And people in this country are not following it. I'll go more into Pakistan because in England, the fine system is in operation. They fine you. I mean, they can fine you up to £100. So here, I think we need to be doing the same thing in Pakistan, that you've got to levy fines. We don't listen. We don't listen to the doctors. We don't listen to the advice. We don't listen to government instructions. So what do? Where do we end up? So the only answer is fines. And of course, the government, whatever is doing in the upper echelons is great. But down, I'm sorry to say that some of the centers are not performing as well as they ought to, because sometimes the internet connection goes off and people have to wait for hours, then they go back, then they don't come back, and then they just leave it just like that. So we need to be ensuring from the hospital authorities' point of view that the internet connections don't go out. Because when people are standing outside and there's walk-in situation as well, so we've got to be, looking at it much more seriously. But Pakistan is getting better, but people are not realizing that Pakistan is still in the red zone, which means a lot of business is being lost for incoming, foreigners and outgoing, for businessmen. So what do? I think the only answer, Faisal, is sadly, is to impose on-the-spot fines, and that has to be the answer. Otherwise, it will just continue, and we have to again just inculcate in the minds that look, you've got to live with this disease, as we live with AIDS, influenza, TB, and all this dengue, diseases. We just got to learn to live with it. But I think it will take time. But the only way quick, as I say, fast forward, is to impose fines, and that is the only answer. And I dare say that it's not making, a question of government making money, but it's a question of saving government money, because the amount of money government is spending on ads, information, pamphlets, leaflets, and so on forth. Well, somebody's got to cover up that cost if the people are not listening to it. So I think this is what I would call it a national emergency and an international calamity, and we've got to be educating people more. You can't blame the governments, you can't blame the opposition, you've got to blame the people for not, respecting what the government is talking about.
The problem again, sir, Mir Sahib, is not only about following the SOPs. A lot of people, I'll just give you the example of our own channel. Around 40% of people, despite that we had proper system here in place inside PTV where people would come and vaccinate you, but 40% of the staff did not get vaccinated just because they thought maybe perhaps it is an international conspiracy against the Muslims or something of that sort. Now, how do you change that sort of a mindset, sir? That is the biggest problem. Forget about not wearing a mask or not following the SOPs. This is perhaps another dilemma, sir.
Yes, but I said, look at it. We changed, or we tried to change the polio syndrome. People were not taking the polio injections. Well, we told them that, look, you've got to have them. You've got to save your children. And this is what we need to be telling them. And of course, what the Sindh government has done, or at least they try to do, that, they'll deduct their pays or the pays will not be given. Well, that is the only way. You've got to be cruel to be kind. And this is that situation which is emanating right now. And as you say, we people learn the hard way. We are the same people who in Islamabad, Lahore and Karachi airport, run around like in a flock. And yet when we land in Dubai or London or wherever, we just, get into queue naturally. Why can't we do it here? Why? What is the problem? Is it because the law is so, so lenient? It says, all right, okay, let's get on with it. No, I think the law has to be very strict, very firm, and of course, what the doctor was saying, I think we need to follow their advice. Otherwise, we're into serious trouble.
I mean, absolutely spot on, Mir Sahib, and thank you so much for your input, sir. Unfortunately, this is what is happening. But since I'm running out of time, last question to you, Dr. Nauman Sahib, that obviously we talk about the COVID-19 pandemic and the social responsibility, the government responsibility, but at the same time, I think it has to have a collective method. It has to have a collective effort also in order to, pass through these tough times. But tell us also about this, that since you talked about that if it is Delta today, it could be Alpha, Bravo, Charlie tomorrow. Is it going to keep mutating, sir? Or there is going to be an end to it? Because I have learned that in 1918, when that particular pandemic started, there were about 7 to 8 different waves during the next 2 to 3 years. Are we going to the same philosophy, sir? Or things can get better, provided if we follow the SOPs and do whatever is required? Dr. Nauman.
Unfortunately, this is true, what you're saying, that 1918, it takes about 4 years, multiple variations. Eventually, hopefully, that's what we pray, it will go away. But yes, it will keep mutating, or it may keep mutating, which I hope that doesn't happen, but it is happening. So the only way to fight is vaccination, vaccination, vaccination. Otherwise, you will never reach the herd immunity. I totally agree with, we all discussed about that. This is a collective effort. The government has to play their own part. Actually, I kept praising Pakistan from day one as compared to United States. Honestly, you can impose this, you will not get paid until you get vaccination. Here in United States, you cannot do that. That's a good thing actually for Pakistan. People may be angry and people may say, oh, what the hell these governments are doing, but actually, honestly, they're doing it for your good. So in United States they can't do it, and actually United States and actually kind of back to square one. But I think in Pakistan you're able to do it. I would say that's one of the way to actually like encourage people to get the vaccination. And number two, I mean, another thing is that this thought of that kids are not being affected. There's so many kids I've seen, 18 months older, they have COVID, they're having problems. I've
Imagine.
seen 5-year-old, they're getting. So I think all together is a collective effort. But
All
again,
right, sir.
we can, not one way or the other. We cannot just blame. I think all.
Definitely. Zaffar Saab, thank you so much for your input. And Dr. Rana, Jawad, was a pleasure having you. PJ Mir Saab, thank you so much for your input as well. And as PJ Mir Saab just said, that you have to be cruel to be kind. I think that is the way forward. SOPs should be in place. People should be fined. People should be taught, should be educated, but should also be threatened to a level that if you won't comply to that, this is what is going to happen. And this is exactly what the Sindh government is doing. But anyway, let's hope and pray for the best. Inshallah, I'll see you again at 8 o'clock tomorrow. Till then, you take good care. Khuda Hafiz.